Lipedema.org. Check them out. That's where this information comes from, lipedema.org. This is part 4 of 6 of the Lipedema flower for treatment, care, and treatment options. This has a whole lot of options. There's categories. We already went through several of them. We went through managing inflammation. We went through decreasing your adipose tissue, reducing fibrosis, and then improving lymphatic flow. Let's go down to this petal of the Lipedema flower for treatment, care, and options. This one they're all really important, but this one's super important too. Do not neglect this. Don't. This is prioritizing emotional lipedema, and lymphedema are very frustrating conditions because of the lack of understanding, the lack of awareness, which is why we're doing what we're doing here at Lilly Clinic, but also the lack of understanding from providers and the way that people are often pushed away. And that has a dramatic negative effect on someone's emotional and mental health. So we can't neglect that. So let's talk about that. Let me get out of the way so you could screenshot this and you could review it. But again, the center of the flower is movement. We know that moving your body helps decrease cortisol levels, which is a stress hormone. It helps us get some energy out. It's good to increase our oxygen level. It's good for our brain. It's good for our emotions. It's good for our mental health. It is also really good for everything else. So movement, again, is so important. Following the petal out here, no, down, sorry, you can see the petal goes like this. So down here, next is stretching, walking outside, dancing, deep breathing, and fitness groups. Groups are great because then there's some camaraderie, right? You're not alone, and you're not alone. There's a lot of you out there that unfortunately are suffering with this condition. But walking is phenomenal. Stretching, dancing is great. I talk about it all the time. But again, it's movement based. Then we go on this side of the petal, and we're talking about stress and sleep and energy conservation. Sleep is incredibly important. One, we have this thing called your glymphatic system, GLYM, which is your brain's lymphatic system, and it works its best when we're sleeping. And our body also needs to heal, and it does that best when we're sleeping. So if we're sleep deprived, our health is going to suffer greatly. The other thing in here is managing stress. Diaphragmatic breathing is great to reduce stress. Again, we know it lowers cortisol levels. Cortisol is your stress, adrenaline as well. But decreasing that, talking with people, improving relationships that are a benefit to you, getting rid of relationships that aren't a benefit for you, talking with a therapist, a counselor. There's an app called Grow, Better Health. There's a lot of things out there where you don't even have to leave your house that could greatly help, because it's easy to get bogged down in the emotions and the stress and the stinking thinking, if you will. So trying to combat that as best we can is only going to improve your health. Let's look down here where we're talking about support groups. So I know Lilly Clinic's page, it's got its page, and then there's the subscriber side, which is a low fee, and that's by design to keep the masses away, because this page has almost 38,000 people following, which is phenomenal because we're spreading awareness, and that's what we want to do. But as far as the support structure, the Lymph Lilies subscription group is more of a supportive structure. And I'm not telling you to go sign up for that. I'm just saying that that's something that I'm offering to people that feel isolated and alone. And it's nice to read through the comments, because there's a lot of dialogue between people supporting each other and offering suggestions and offering a hand, offering hope. So support groups are incredibly important, especially when it comes to a condition like lipedema and lymphedema, where there's so much ignorance about it. People just kind of brush you off and don't believe you, and that doesn't help. So surrounding yourself with people that understand or are in the field that are trying to help is a benefit to that. So don't neglect your support groups. Self-advocacy. I talk about self-advocacy a lot because if your providers are ignorant, you're not going to get the care that you need. You have to self-advocate. So understanding these conditions is only going to help you. Counseling, as I mentioned earlier, patients, friends, community advocacy, conferences. You could attend conferences as a patient. You really can, and they are expensive. Everything's expensive, but getting involved in the associations that people like me are involved with as a patient is going to benefit me, it's going to benefit you, and it's certainly going to benefit the level of awareness and also treatment, because when there's a bridge between patients and therapists and providers and research, then good things start to happen. So don't neglect your stress, your emotions, and your mental health. Mental health is part of our health. We all have it, and it all fluctuates every day. Sometimes I physically feel really good, sometimes blah, and sometimes not good. Sometimes my brain feels really good, sometimes blah, and sometimes not so good. We need to break that stigma too. It's okay to talk about things. I hope this helps.